What is the best lens for cataract surgery? Now, tonight's video, today's education, we're going to be breaking down cataract surgery, how it's traditionally performed, some of the newer technology and options such as laser cataract surgery, and the different IOL or intraocular lens implant options for cataract surgery. We'll be breaking down the pros and cons so that you understand really what all of your options are and what may be working best for you. Now, this is an important topic because in the world of eye care, cataracts is something that almost everybody will develop if you live long enough. And we even just had a very famous YouTuber named Mr. Beast who did a video about a doctor doing cataract surgery in some third world countries or developing countries. And that was a very just great video of bringing kind of everyone's attention to cataracts and the option for cataract surgery. So let's dive in and discuss our options for cataract surgery and the different lenses available. So first, I want to break down what cataracts are and how the cataract surgery is traditionally performed. So during the development of the eye, we develop a crystalline lens inside of the eye. This lens allows you to focus on different focal distances, whether you're looking in the far distance or up close, you have to flex this lens. And when you're born, it's crystal clear. But as you get older, this lens begins to fog over. So this lens helps focus the light to the retina in the back of the eye. And this is a great photo because you can see the flower in the front of the eye. The image of the flower is nice and clear, hitting the back retina in the back of the eye. The lens then focuses that light to hit the retina. But inside of the eye, if the cataract or the lens starts to become opaque and fogged over, we can see in the clinic that the lens starts to kind of has this cloudy appearance. And some people develop kind of a brown yellow appearance in this lens. And that's what we call a cataract. This is a picture that I took of a patient that I saw when I did a mission trip in southern Mexico. And you can see how in the center pupil, it's not dark, it is almost pure white. And that's because this individual had such an advanced cataract that it's become completely opaque and they can't even see anything out of that eye. So they are a perfect candidate for something like cataract surgery. So the problem is that as you develop this fogged lens inside of the eye, because some people think cataracts is like a fogging in the front part of the eye, it's actually internal. It's happening inside of the eye. Because this lens becomes opaque, light cannot pass through it and hit the retina appropriately. And so people start to have symptoms of blurred vision, fogged vision, and they start to have challenges seeing in dim light, especially while driving at nighttime. They can see a lot of glare. Now, to better explain kind of how cataract surgery works, I wanted to take a moment and we're going to watch a video together as I kind of walk through what we would see or what traditionally is done during cataract surgery. This is a video provided to us by the Zeiss ophthalmic company. They develop a lot of, they make high quality lenses for things like glasses, as well as lenses that we use in the eye clinic and different instruments. They even make some lenses for cataract surgery. This is not sponsored in any way, but this is a video that Zeiss did with a great animation showing kind of how at the beginning of a surgery, they do numb the eye so you don't feel anything. And then a type of blade is used to cut a 2 mm incision on the surface of the eye. There's usually 2 incisions that are made, sometimes 3, but usually 2. And this type of scalpel is used to just create a very tiny open wound on the eye. This allows for your surgeon to put different tools inside of the eye so that they can inject a fluid inside the eye, which we'll see here next. This is called viscoelastic. It's basically kind of almost a water-like jelly. This helps inflate the eye and keep it kind of open so there's enough room for all the surgical tools to move around. It also helps dampen any extra energy that may be causing friction or kind of vibrating around inside of the eye, preventing other damage to other structures. The next important step is called a capsular hexus. Your surgeon would use this little hook to create a small opening on a bag that holds the cataract, because inside of our eye, the lens and the cataract is inside of a clear membrane bag. And they have to create a hole in that. So they make a perfect circle. And then this new instrument that you see is what's called phacoemulsification. It's a brilliant tool that uses ultrasound to shatter the cataract inside the eye. They shatter it in many millions of tiny little pieces. And then that same instrument uses a vacuum suction to remove the pieces from the cataract. And what's left over is basically just that bag sitting inside the eye, where the next step, the surgeon will put a lens into the eye. This is the implanted kind of lens option that goes inside the eye after cataract surgery. It's folded up like a taco, and when they release it, it unfolds and sort of locks itself into place. And if it's a little bit out of position, your doctor can rotate it and move it in the correct spot. But once it's in place, the surgery is done, and takes about 10-15 minutes usually at most. It's pretty amazing how fast and efficient they are at this procedure. So what are our options? So that's traditional cataract surgery. One of the more common things you will see kind of after, one of the other things that you'll see oftentimes talked about or recommended, I've even seen billboards about this, but there's something called laser cataract surgery. And so a lot of people ask, what's the difference between traditional and laser cataract surgery? In the eye care world, we call this FLACS, for femtosecond laser assisted cataract surgery. And really the difference is that in traditional methods, like we saw in that animation, first, traditionally we use a type of scalpel blade to create an open wound on the eye. In laser cataract surgery, they use a laser to make that incision. Very precise, and it causes typically less kind of inflammation, that is believed. The other component is that capsular hexus, where they create a hole in that bag. That, instead of being done manually, also is done with a laser. And then they have the breaking of the cataract inside the eye itself. Instead of just relying solely on the phacoemulsification and the ultrasound, they can use the laser to basically cut up the cataract inside the eye into many millions of tiny little pieces, all using a laser, which makes it very precise and reproducible. They have that nailed down mathematically. Now, the big question is that better? Because typically laser cataract surgery, if you're going to go the route of laser, is going to be more expensive. So this has been kind of investigated since about 2011, since laser cataract surgery started to come out. And in 2022, a publication did find, comparing many different procedures, that the mean outcome of improved vision in the distance without glasses, as well as the ultimate best vision from patients even needing glasses afterward, found that both of those techniques were basically the same. And they also found that complication rates were the same. Furthermore, even in 2023, a recent publication from the Journal of the American Medical Association found that this laser cataract surgery is just less cost effective, because the outcomes of traditional surgery versus the laser are almost the same. I think it's important to address that, again, because there is this cost difference. However, I know a lot of surgeons who still, despite knowing this, will still talk about and recommend the laser procedure, especially in the case of premium or specialty lens implants, because again, the laser procedure is a little bit more precise, and they can maybe reduce kind of potential complications or side effects. Although, even though we know the end results are oftentimes very much the same. So now that we've talked about the options of how traditional cataract surgery is performed, and maybe what would be different if you had the laser cataract surgery, let's talk about the IOL, or intraocular lens implant options. So the most common one that your doctor will talk about and mention first is monofocal lens. monofocal, meaning one focus. These monofocal lenses are excellent for just one distance. Most people do choose this lens for both eyes to be their priority in the distance. So if this was the option you would go with, you would, at the end of the procedure, hopefully see amazing in the distance. The downside is that you're unable to use your eye muscles to focus on things up close. And so oftentimes these individuals rely on reading glasses whenever they have to, again, read a book, look at their phone, or anything like that. So they are often taking their glasses on and off throughout the day. But this isn't always the case. For example, my father, when he had cataract surgery, he has been so used to wearing glasses since he was about 8 years old that even though he really doesn't need glasses to see far away, he just gets glasses made with progressives or varifocal lenses so that in the distance, he has almost no power in the glasses in the distance, but it allows him the convenience of wearing his glasses so he can still use the bifocal component to read up close without having to take the glasses on and off all day. There is the option for monovision, which if you've never heard of that, that's where the implant can be set for one eye to be far away and the other eye to be set for up close. And that may sound a little odd for some people who've never heard of that, but we do that with contact lenses and even for LASIK eye surgery. And for people who can adapt to it, it can offer them great kind of the ease of life of not having to rely on glasses as often. So that can be done with those lenses. Some people, and it's not very common, and I think most surgeons recommend patients not do it, but there is the option to have both their eyes set for up close. That means that if you're somebody who reads all day long, like you spend 8+ hours a day looking at something up close, reading, doing a hobby, and you would rather not wear glasses when looking up close, then you can choose to have both eyes set for up close and then just wear glasses to view in the distance. It's kind of backwards. And I guess most surgeons I've worked with don't recommend that. However, there are patients who choose that and they have good success with it. But it's something to discuss extensively with your surgeon if you're going to be considering just having lens implants just to see up close. I just think it's really good to think about that. The other kind of good component I think people should know about with monofocal lenses is that it's usually covered by insurance. Now, I practice here in the United States, and most of our viewers are from the US. And if you have medical insurance, most medical insurances will cover cataract surgery if it is medically necessary. And nobody's going to really refer you for cataract surgery unless it's medically necessary. But we'll talk more about price and insurance coverage and all of that later in our education. The next option are for toric lenses. For anybody who's heard of astigmatism before, if you've been told that you have a significant amount of astigmatism in your eye, and we've done other videos on astigmatism and even more of a recent deep dive into astigmatism, and we'll put links to those videos in the description below. Or if you're catching us live in the chat, we'll see if we can link up some of those. But astigmatism correction can make your vision really blurry. So even if you got the previous monofocal lens, you have significant astigmatism, after the procedure, you may still have blurred vision. And so toric lenses exist, and this can correct for a majority of that astigmatism. Ideally for individuals with about 0.75 to about 5 diopters of corneal astigmatism, this is a great option. And I put an image of that lens, this kind of yellow lens with these 3 little dots over in the corner that I circled with a blue marker. That's the dash marks that myself, if you came in to see me after having a toric lens implanted and we're just seeing you for a regular exam and I dilated your eye, I could tell if you had a toric lens implanted because I would see those little dots. That tells me where the astigmatism correction has been placed. This is, again, great for individuals who just want single vision in one plane, like they want to see distance really, really well. And there are some presbyopia correcting implants that come in astigmatism correction too. And we'll go over that next. So if you've never heard of the term presbyopia before, a lot of people do experience this. Once you're over about the age of 40, everybody's eyes, the lens begins to stiffen, becomes rigid. Inside the eye, this lens becomes tough and rigid, and you can't really use your eye muscles the way you did when you were 20. And so your eyes start to fatigue when trying to read up close, seeing your phone or a book, and you feel like you need to push things further and further away. So the implants for cataract surgery are now trying to solve for this so that people don't have to rely as heavily on things like reading glasses or glasses, period. And these are a couple of the options we're going to review: the accommodating IOLs, extended depth of focus IOLs, and then multifocal or trifocal IOLs. So the first one, let's talk about accommodating IOLs. These ones, I do want to mention, I feel like they've lost some favor. They're not as kind of the sexy lens on the market anymore. Maybe about 10 years ago, they were a bigger deal, especially when I was still a student in school. One of the doctors I worked with, he had awards for implanting many of these options. These lenses are flexible, and some of the newer designs that are on kind of up and coming are even filled with fluid, because this allows you to activate your eye muscles just like we all do, especially when we're young. We use our eye muscles to see up close. By using the muscle, it allows the lens to flex, or it allows for a fluid change inside of the eye. And then that allows for the magnification or the power of the lens to change, giving you an improved range of clear vision, being able to look from distance clearly to kind of intermediate like your computer, or to even really up close like your phone. Now, again, there's only a few lenses like this available, and I know there is one that's available for astigmatism, but I feel like they're not as recommended as often right now, just because there's newer technology that's come out, which I think a lot more people are having success with. But I wanted to mention this one because, again, there's at least 5 different companies I've heard of that are developing new versions of these that, if they're successful, then we'll see kind of a new rise in lens options in the upcoming maybe 3 to 5 years. But as always, we don't know if these technologies are going to pan out. But if this kind of sparks your interest and curiosity, definitely subscribe to our channel if you haven't done so already, as we will produce more videos going over these new technologies as they come out. The next one is Edofiol IOLs, or extended depth of focus. These lenses are pretty fascinating with how they're using optics technology into one single lens. They have these little rings or kind of grooves like made into the lens, but what it does is it gives you an improved depth of focus. To kind of explain what I mean by depth of focus, if I hold up this pen here, if I try to focus, my depth of focus may be like the space between my fingers. I'm trying to look in the camera so you can see it. My depth of focus may be the space between my fingers. If the pen lies right in between my fingers, perfect. I can see that pen perfectly clear. But if I'm a little bit off, if I'm focusing in front of the pen, then the pen's going to be blurry. Or if I'm focusing behind the pen is also going to be blurry. But if I can improve this depth of focus or between my fingers, then if I focus in front, as long as I'm still in that zone, I can see the pen clearly. Same thing going backward. It improves and expands that depth. And that allows you to have improved clarity of vision in the distance and seeing intermediate, such as maybe while you're driving, you're able to see down the road, and you're still able to see your dashboard clearly without even having to really focus your eye muscles too much. The only thing is, in my experience and published in some publications, they've noted that while, yes, people can still see things like their phone and read up close pretty well, some individuals still require reading glasses to see really fine print. Like if you're going to sit down and read a book, maybe study the Bible or something like that, then up close, that fine print is going to be challenging, and you may still need to rely on reading glasses. The other thing with these type of lenses is that because they have these concentric rings kind of etched into the lens, they do carry a kind of a con or a side effect, which is shared in multifocal lenses. Multifocal or trifocal implant options, these also have those concentric rings, kind of like you can see in the image. What's nice is these multifocal lenses, they have improved in their technology quite a bit in the last decade. And one of the newer lenses on the market, I know a lot of surgeons are preferring this lens because so many patients are having good success with it. But these lenses give you clear distance vision, they give you clear intermediate vision, and they let you see fine print up close. You can see all three ranges. The challenge is that because of the optics of this lens, you technically see all three of these ranges all of the time. But kind of the intermediate space in between, your brain needs to kind of figure out which image you're going to focus on. Are you going to focus on the distance one, the intermediate one, or the up close one? It sounds a little confusing, but most people naturally gravitate toward this lens and have excellent vision afterward. And I think that's, again, why so many surgeons are preferring this type of new multifocal or trifocal lens. So this gives you that great distance vision, great intermediate, and great near vision. So a lot of patients who get these type of multifocals don't have to rely on glasses as often. The downside, just like the extended depth of field focus lenses, is a lot of people can suffer from ghosting, glare and halos, and reduced contrast in your vision. So that means that at nighttime or in dim light, you may have more challenges seeing clearly. And if you're driving at nighttime, headlights, you're going to see a lot more glare and a lot more halos. I think for individuals who are a little bit more relaxed and are not really bothered by that, you're really just enjoying having clear eyesight. You maybe don't drive at nighttime too often. And just these little things of glare are just not that irritating toward you. You've never suffered from problems with glare or ghosting, then multifocal IOLs can be, I think, a game changer for a lot of individuals thinking about cataract surgery. Now let's talk about one of the newer technologies that have come out. This one's called the light adjustable lens, or the LAL. So this is a new and growing technology, and it's technically been out for a good maybe 5-6 years, but it's becoming more available around the world and certainly here in the United States. So what's so special about the light adjustable lens is that this lens is customizable after cataract surgery. This means that most other lenses that we've discussed so far, your doctor has to first calculate the power of your eyeball, the power of the lens that not only your glasses you normally wear for your glasses, but then they have to calculate the power of the lens that'll be implanted inside of your eye. And with this lens, you don't have to do that. In fact, after the procedure has healed and everything's doing well, your doctor can use a special light to tweak and change the power. So that can give you amazing benefits, really, around having just the most accurate vision after the procedure. And so if you're somebody who, really requires amazing single vision, you want to see as clearly as possible, you want as accurate a vision as possible, even if you have some level of astigmatism, it can correct to up to about 2 diopters of astigmatism, then this may be a great option. I do want to take a moment just to shout out one of our viewers, Bronson, who just gave us a nice super thanks. So I appreciate you so much. And thank you for supporting the channel. It does mean a lot. For those of you who are catching us on the replay, we do record these lectures live, and we encourage you, if you'd like to, certainly subscribe to the channel and become a channel member if you wish to continue to support us and contribute in our live Q&As. So thank you guys all. Let's keep talking about light adjustable lens, because this is absolutely fascinating. So what they did is they found out, hey, we can make this lens, this implantable lens, out of a different type of plastic. And with this type of plastic, we can use an instrument in the clinic that shines light on the implant, and it'll change the power. It'll literally change the shape of that lens inside of the eye. And so maybe 2-3 weeks after you've had cataract surgery, we can shine this light, tweak it a little bit, have you back in a few days later, tweak it a little bit till we get you seeing just how you want to see. And then they can shine a special UV light, which will cause this new implant to lock in. It'll harden. And we usually do a couple of different treatments of this hardening part of the procedure, but then it gets locked in and held right where it needs to be. So I kind of want to break this down because a lot of surgeons are starting to adopt this, and a lot of patients come in asking about it because they've heard about this like crazy new technology and implants. And I want to kind of give you what to expect if this is something you're considering. First is, again, these lenses that are implanted in the eye, they are kind of locked in. The power of the lenses is locked in by UV light. So it's super important that after the procedure, our patients are wearing UV light protecting glasses. We provide sunglasses that they can wear outdoors that are big fit over ones, kind of in the picture here. And then they have more clear lenses, same kind of style, but clear, that offer UV light protection that they can still wear indoors and doing other activities. And this prevents natural sunlight from entering your eye and hardening that implant. Because again, we still want to tweak it after the cataract surgery. And you want to expect that it's going to take many more visits seeing your doctor, because there's just a couple of more times we need you to come in so we can figure out the glasses prescription, dial it into the instrument, activate the light, get it to slowly change until it's just right, and then we can lock it into place. So whom is this really for? Who is going to be the best candidate for the light adjustable lens? Anybody, and this is somewhat on my personal experience, but anybody who's had anybody who's been post LASIK or had LASIK before, maybe in the middle 1990s, late 2000s, anybody who's had LASIK or PRK or other forms of refractive surgery, this may be the best option. And I say that because during the cataract procedure, we can control so much, but we can't control how you heal. And if you've had refractive surgery, the cornea's physiology has already been kind of changed or altered with those surgeries. So if you're thinking about cataract surgery and you've already had LASIK, then perhaps the light adjustable lens will give the best chance of your surgeon just getting that the power of the implant right where it needs to be, so they can give you the best vision possible. And so I think also, just from a personality standpoint, if you're somebody who knows that you need to see as sharp as possible./I've had some sharpshooters and military personnel who they can tell if their vision is even just a hair off. Like, they demand 20/20, if not better vision at all times. If that sounds like you're that type of person, then again, light adjustable lens may give you the best chance of getting that precise vision. Then if you're somebody like we talked about the trifocal and you're like, hey, that sounds great, but you don't, that sense of glare, halos, starburst, maybe you drive a lot at nighttime, you're like, no, that starburst glare issue, you don't think you could handle that, then perhaps again, the light adjustable lens would give you that precise vision and you wouldn't suffer as much from things like glares, halos, and starbursts. I think those are just good things to consider, depending on what type of lens and lifestyle that may fit for you. So let's talk about cost, because this is always a good question. Everybody wants to know, how much do these different lens options cost? What's it going to come down to? So if you get the monofocal lens, again, that's the standard lens that medical insurances usually cover. Here in the United States, patients, if they have a medical insurance, they usually pay anywhere from $0 to maybe $200 for a deductible or whatever fees for copays, or they have to buy the medications. But usually it's not much more than that for just getting the standard procedure. But if you're getting one of these special lenses, these are premium products. A lot of research goes into making these types of lenses, and it also takes a bit more skill and training on your surgeon's part to be proficient on these types of lenses. then expect it's going to cost somewhere between $1,000 to up to maybe $4,000 for each eye. And a lot of that price range does depend on the type of lens that's being put in. And this also can vary based on location and the provider. But just sort of to have a general ballpark of what it may be costing you out of pocket to have like that upgraded experience and have this freedom from having to rely on glasses as much, then that's kind of the ballpark of expect what you would pay, at least here in the United States. And as always, make sure to talk with your local surgeon about your special case, what they recommend for you, and kind of what's going to be really the best options. I do want to mention two other things. First is the complication, and then secondly is just kind of a tip for everybody who's considering cataract surgery, because I want you to have the best success possible. The most common complication from cataract surgery is called a posterior capsule opacification, or a PCO. This occurs in the older research. It would quote 20 to 80% of cases would develop this complication. Thankfully, due to new lens designs, the new technology that's coming out, and some changes in the procedures, this statistic has come down. So it's maybe 20 to 50% of cases, but it's still rather significant. And I think anybody having cataract surgery should at least be told that this likely will happen at some point, at least within the first 5 years after cataract surgery. This is where remember that clear bag that during the procedure, they had to cut open that bag? Well, they cut open the front part of the bag, but they don't cut out the back part of the bag because they leave it there because as the implant goes into the eye, it kind of works like a scaffolding to hold the lens implant in place. But after the implant's settled in, everything's healed, that back part of the bag can shrivel up and sort of fog up the lens. And so even some of my family members who've had cataract surgery, they've noticed their vision suddenly getting kind of fuzzy a few months or even years after their cataract surgery. The good news is that if this happens, if this posterior capsule opacification occurs and the lens becomes fogged over, there is a very quick, easy procedure to fix it. We call this a YAG laser capsulotomy. This is done in the eye clinic, so you don't have to go back into the operating room. This is a small laser that's docked on our normal microscopes we have in the clinic that your doctor can then dilate your pupil really big. We can see that growth over the implant, and then we can use the laser to shoot and break up that haze that's building up on that implant. And once that's gone, once we've treated it with the YAG laser, it's gone. It will not grow back a second time. So that's just a wonderful, quick thing to know, that even though this kind of complication is pretty likely, that the procedure to fix it is quick, it's easy. And in fact, it's so easy that most doctors perform this within like 5 minutes. It's that fast. This is a procedure that I was trained on as an optometrist back in 2013, 2014 when I was in school, and I still hold a certification for it and get retrained on it frequently. So it's a great procedure. Depending on the state you live in, your optometrist or whoever's doing your primary care may be able to do this procedure for you. Otherwise, they will often refer to back to the surgeon that did the cataract surgery or another qualified surgeon in your area to do this laser treatment. My pro tip, and I've talked about this in previous videos, but if you are considering cataract surgery and you've ever had difficulties with dryness of your eye, or even if you don't feel your eyes are dry, but your doctor says your eyes are dry, then consider starting to use preservative-free, just lubricating eye drops at least 2 to 4 times a day, getting up to your evaluation for cataract surgery. And I say that because when your surgeon has to evaluate and take the measurements for how strong your eye is, for what type of lens may be best for you, a lot of those detailed calculations can be swayed off if you have dryness on the surface of your eye. In addition, cataract surgery, because of all the inflammation and all the eye drops you have to use after the procedure to help with healing, cataract surgery is known to cause or exacerbate worsening dry eye. And so it's always best to sort of be proactive and try to get dryness under control before pursuing cataract surgery. So thank you guys so much for kind of giving me the time to explain all of this detail. I'm sure if you have questions, I encourage you to let us know in the comment section, or if you're catching us live, let us know right now in the chat. I do want to start off saying thank you to all of our channel members who support us and help and prioritize really bringing educational information about eyes and vision care to the world. This has been just an amazing journey for myself, as I've just loved teaching and talking about my profession. With our with our Q&A, as we're going to move into this, I always like to give a medical disclaimer that you deserve the best possible eye and vision care. And to do that, I cannot try to offer that through a camera and through YouTube. I think you deserve and need to see a local eye and healthcare professional in your area so that you can be evaluated and diagnosed and properly treated. Otherwise, anybody who has questions about their own personal case, or if you have curiosities about cataracts or eye floaters or dry eye, I'm happy to try my best to answer them in an educational manner. Please, right now, drop some questions. Try to put some question marks in front of your question and then following your question so it stands out, and it'll make it easier for us to recognize and see that. I know right away I do see Babette McCurdy asking, where are you located? I am located currently in Minnesota. I practice at the Pinecone Vision Center in Sartell, Minnesota. And I've been practicing there technically since 2016, since I finished my residency. And then I left for a few years at a different eye clinic and eventually came back. Yes, so I still do practice a couple of days a week, and I'm an adjunct clinical professor, so we have students at our clinic. So if you're ever to travel to come see me at our clinic, you may see one of our students who is in their final year of their education, and then you always will end up seeing myself or another provider in the clinic. I did have a couple of questions from some individuals who came right on to the live, and I wanted to kind of give them some priority. The first question was about retinal detachment. If you've had a retinal detachment or any retinal complication history, and you're considering getting cataract surgery afterward, because oftentimes retinal surgeries, whether it's a retinal detachment or you've had treatment for floaters inside the eye, a lot of these procedures will induce or cause a cataract to form faster. And so if you are somebody considering having cataract surgery after a retinal procedure, a lot of these implant options are still available, especially if you're somebody who has astigmatism, then certainly a toric lens may be a great option. However, there is some debate in the eye care community of all the different doctors out there about if the specialized lenses like multifocals may not be the best option, because all of the extra glare and maybe reduced contrast will make vision more difficult. There is a recent publication that did come out. I haven't fully completed reading it, but I do believe it sort of maybe dispelled some belief in that. They kind of had a counter argument that perhaps it would enhance or make it, that there's no data to support that it's not a good option. But I'm sure if you discuss with your local surgeon about the best option for you, they may discourage you from considering something like a multifocal option for that exact reason. The other question I had was about sunglasses. And this is a good question because if you've ever talked to an eye care provider, if you've seen other videos here on this channel, or if you ever came in to see me and we're talking about, hey, you have a slight cataract developing, but you're not maybe a candidate for cataract surgery yet, how can you slow it down? How can you slow down the prevention of cataracts? One way, and something that doctors will often recommend, is to have UV light protection, to wear sunglasses. If you're somebody who doesn't like sunglasses, doesn't wear sunglasses, maybe you don't have them, it doesn't have to be anything fancy for sunglasses, as long as it says 100% UV light protection on it, 100% UVA, UVB. That's going to be good to protect your eyes. But even a wide brim hat, something to protect your eyes just from adding shade, should at least help reduce a lot of sunlight exposure. I think I've read in a book that's about 30% reduction of UV light exposure to the eye, because everything else, the light will bounce off, like the road or certainly water will bounce up and maybe hit you from underneath, but at least the direct light from overhead will be diminished. The other big question, I see a lot of questions coming through, and we're going to get to everybody. This is just the one last quick question I wanted to throw in here, was about treatment time. Like for cataract surgery, how long does cataract surgery take from start to finish? Once your surgeon has determined that, hey, we did the assessment, they did all the measurements, they've talked with you about what lens option you want to go with, then the day of the surgery, again, it takes about an hour to get somebody prepped for cataract surgery, but only takes maybe 10, 15 minutes to finish the procedure. We usually do one eye at a time. However, some new procedures are starting to consider doing both eyes at the same day, but most surgeons still do one eye at a time. Then it takes about 2-3 weeks, and then they'll do the other eye. After that other eye is completed, it's another 2 to 4 weeks for the eye to completely heal. So expect it'll take around maybe 6 to 8 weeks for the full process. With all of that in mind, another common question I get in the clinic is, what kind of vision can someone expect right after the procedure? Like if you have one eye done, what are you going to see the next day after surgery? Usually, and I think it's realistic to expect that right after the cataract surgery, like you just had a major surgery on the eye, there's a lot of inflammation going on inside of the eye. Kind of like if you had knee surgery, your knee would be swollen, right? Well, the eye has some swelling too. And so I think it's realistic to expect that vision will be a bit fuzzy for the first few days after cataract surgery. It's not quite like LASIK, where you have the procedure done, you sit up and you're like, wow, I see 20/20 again. It's not quite like that. It's much more invasive. However, I do, just in my own experience, a lot of the surgeons I work with, I do have a lot of patients who see, if they're not seeing 20/20, they're pretty close. They're better usually than 20/40. That means that they're usually legal to drive in that eye that was just operated on within even a day after surgery. Of course, this is highly dependent on everybody's procedure, how advanced the cataract was, and other factors with eye health. So take that with a grain of salt, but I think those are good common questions that I've heard. So thank you. I'm going to kind of jump back into the questions people are dropping in. Thank you guys so much for being here. Let me see here. Let me see. Again, going back to, should one do both eyes at the same time? Some doctors are doing cataract surgery in both eyes at the same time. Historically, it's been sort of avoided because there's always the chance that maybe something will go wrong during the procedure, and it's better to have something happen with one eye than both eyes. Although cataract surgery is considered one of the safest surgeries out there, and chances of serious complications are very, very low. There's other potential concerns of what doing both eyes at the same time as well. But as more techniques come out and more research comes out, perhaps the kind of status quo will change. But right now, I think most surgeons will still do one eye at a time. This is a very good question. Thank you, Rana, for asking this. Rana asked about RK surgery. That's radial keratotomy. This is an older version of refractive surgery that isn't performed anymore, but it was sort of predated LASIK and PRK. The challenge is that some people with having RK, and it sounds, Rana, I'm sorry that you've had difficulty with this. Like you say, your eyes change shape throughout the day, and that can be really frustrating because your vision is just constantly fluctuating. So cataract surgery can obviously change the power inside of the eye and the lens for removing the cataract, which will likely improve vision. But unfortunately, the RK incisions from that procedure can't be undone with cataract surgery. So it's likely the vision may still fluctuate afterward. And I imagine most surgeons would discourage you from considering any advanced types of lenses. Again, talk with your local surgeon and what they are experienced with. I believe some doctors have now started to experiment with using a similar procedure used for a condition called keratoconus, where we use a type of light and some natural vitamins to harden the surface of the eye. It gets the cornea to stiffen up. Perhaps they may consider if that type of procedure would help you with RK. But I haven't personally read any new research on applying this type of technology to RK, but it's something I think if I was in your position would be worthwhile to discuss with a local doctor. So thank you. Another good question. Hey, LBS here. Do IOLs ever move this changing their effect focal point and hence one's prescriptions? It is highly unlikely for lenses to move or shift inside of the eye. There are some individuals who have medical conditions that the structures inside the eye can change and let go. And thankfully, it's very rare, but sometimes the implants can dislodge and they fall back into the eye. In those cases, we basically schedule patients for an emergency surgery to have that implant removed. But again, very rare for that to happen. Otherwise, the lenses almost never move. So good question. A good question from Swag. Do you know if Elcon makes LALs? I know they do IOLs. Elcon does make a lot of good implant options for IOLs. They are currently the manufacturer of the multifocal, the trifocal lens that I've seen a lot of doctors have success with. But I do not believe they currently make an LAL. But again, this is newer technology, and as more research is coming out, I wouldn't be surprised if they currently, I don't know this, but I wouldn't be surprised if they currently have something in development, just because it's new technology and everybody wants to jump in on it. Barbara asks a great question about how will cataract surgery affect your floaters? So if you're somebody who doesn't have floaters yet, having cataract surgery may increase the risk of developing floaters. Furthermore, if you already have existing floaters and you're getting cataract surgery, it's tough to say if it'll make it better or worse. I've had some patients tell me that after cataract surgery, they don't see their floaters as often. But then I've also had some patients tell me they see their floaters way more often. So it's tough to say. In general, after cataract surgery, most people do notice that their eyesight, things seem brighter, less dim, because the cataract was kind of acting like a built-in sunglasses lens. Everything kind of gets cloudy, a little bit faded. And so when we remove that lens, everybody can see better. Like everything's way, way brighter. And then a lot of people notice color vision changes because, again, the cataract, as it develops, usually becomes kind of a yellow brown color, and that kind of filters out blues and blacks, kind of makes it harder to detect those subtle differences. But as far as floaters go, it's tough for me to say if it would cause floaters to get worse, better. I think it's very independent. But a good question. What about patients from Charlie? What about patients with severe glaucoma? So same thing with the question about retina disease. If somebody has severe glaucoma or limited vision due to glaucoma, then something like the enhanced depth focus lenses or multifocal lenses may not be as recommended, at least at this given time, because it's believed that with the reduction in contrast sensitivity, that perhaps those lens options aren't the best. But usually cataract surgery lowers eye pressure just a little bit. And now there's what's called MIGS procedure. These are micro implantable glaucoma shunts They basically drain fluid from inside the eye, so they can lower the eye pressure. And a lot of patients who get cataract surgery can have MIGS at the same time during the same procedure. And this significantly lowers the pressure, and a lot of patients may not have to be as reliant on topical medications, or maybe even need to use eye drops after all of these procedures at all. And it can be really helpful to help with not having to worry about missing eye drops or missing your medication or having to pay for additional eye drops throughout the rest of your life. So these are just good things to consider as great benefits for having cataract surgery if you're somebody who's suffering from glaucoma. A good question from Stefan. Are premium lenses an option for some with high myopia? Yes. It definitely depends on the brands, but most of the implants for cataract surgery can go to high levels because it's not like glasses lenses where they get super, super thick. The implant can just small tweaks in the power can make a big change for the implant. So thanks for asking that. But yes, there are a lot of lens options for high myopia. Let's see. Ooh, good question from Steven. How accurate is the autorefractor for determining lens calculations? So an autorefractor, for those who are unaware, an autorefractor is an instrument we use in the clinic that measures, it shines light into your eye, hits the retina, bounces back towards the instrument. And based on how that light is bent by the structures of your eye, it can sort of get a guesstimation of your something that's needed, like your glasses prescription. So I've never seen an autorefractor that's perfect. It usually takes multiple measurements very quickly and gives us an average. It's also something that I've seen faked and fooled, especially by young children and from advanced cataracts, because the light has to pass through that cataract. And if your cataract is really dense, that autorefractor reading is really tough. Thankfully, if you are going to have measurements for your lenses, your surgeon will likely use not just an autorefractor, but then they'll have the technician or another doctor like myself do the refraction manually to determine your best set of glasses prescription. But then they'll use a couple other instruments to measure the depth of your eye and potentially what the ideal lens power would be for the implant. But I would say autorefractors, they're a great tool, but unfortunately they can be fooled. And every brand's a little different. And if you ask every different eye doctor, they'll tell you, maybe 2 or 3 different brands maybe are more accurate than another. So good question. I just want to give a shout out to I Am Gold Sales. First time watching live. Thank you so much for being here. I greatly appreciate it. I hope you're enjoying the content. Let's see. This is a little different than just cataracts, but Slot Kitty asked, mentioning anisocoria and pigment dispersion syndrome. So anisocoria is where one pupil is a different size than another. Anisocoria can occur due to different reasons, whether it be due to trauma, whether it be due to a medical condition. Some people are even just born with physiological anisocoria, where one pupil is they're born with it, one being larger than the other. Pigment dispersion syndrome is where the pigment on the back side of your iris, so the colored part of your eye, and the back side of it, there's kind of a brown pigment. And the lens inside your eye is, the crystalline lens is held in place by a bunch of little strings called zonules. And especially when we're young, these zonules and the lens rub against the iris on the back side of the colored part. And this releases a bunch of pigment that float inside the eye, and they get trapped inside the drainage canal, and then your eye pressure goes up. Not everybody's eye pressure becomes an issue, and not everybody with pigment dispersion develops glaucoma. But it is something that we have to be aware of. Your doctor has to identify it and test for it to make sure that somebody doesn't develop glaucoma, because unfortunately, pigment dispersion glaucoma can be really frustrating to treat and manage. So I'm happy that your ophthalmologist caught it, diagnosed it, and is watching it for it, because it sounds like they're doing their job. Typically, you can't really treat or do much for these conditions. If somebody's really bothered by anisocoria, like their pupils really large and they're having glare and light sensitivity issues, there are specialty contact lenses that can be made to give you a kind of the appearance cosmetically, but also functionally, they can kind of give you the same optical benefits of having a normal sized pupil. And for individuals who've lost their iris from something traumatic like a damage, there are iris implants. I even have a patient who's had a custom iris implant implanted in the last year. It's pretty amazing what they're doing. But as far as managing things like anisocoria, pigment dispersion syndrome, best thing for you to keep doing is seeing your doctor and following up as they recommend, so that they can keep monitoring your eye pressure, and that they can kind of just watch to make sure you don't develop glaucoma. I do have a couple other videos on glaucoma and even kind of some recent research on natural ways to reduce your eye pressure. Those might be of benefit for you, but thank you. And I want to give a shout out to Gail. Thank you so much. I noticed you changed your avatar photo. I love the hair. It's amazing. And those sunglasses look great. So thank you for being here. For Lainey, thank you for asking about terrible cases of floaters in the eyes. So I have done some other videos on surgical options for floaters, and this is something definitely to consider if somebody's struggling with large floaters. The two most common surgical options available are either using laser vitreolysis, which is where your doctor can use that same YAG laser we discussed before for the posterior capsular pacification, except it's used deeper inside the eye to break up large floaters. It doesn't get rid of them completely, but it breaks them up into smaller pieces, and it vaporizes some so that people are less symptomatic. There is also an option for a vitrectomy, where your surgeon can completely remove the gel inside the eye. However, both of these procedures do carry some side effects and potential complications. And your most retina doctors that I've met don't love doing these procedures, because most of the patients still see 20/20. And they don't want to take that risk of potentially causing a retinal disease or a bleeding issue or cause vision loss for anybody. So something to consider, and consult with doctors in your area if there's somebody offering these procedures. But it's something that don't be surprised if you notice talking with a surgeon that they're just not, they don't feel most comfortable offering that procedure. But thanks for asking that. Another good question. This is a little, again, different topic than anything around cataracts, but I know a lot of people have this sort of question. Is it all right to use a laptop at night with lights in the room turned off? Does that cause more eye strain? I haven't seen any studies specifically giving me like a scientific answer to this. Theoretically, it may potentially cause more eye strain, but it's tough to, I think it's very individual. I notice in myself that I maybe do get more eye strain with just one single bright light hitting me in the face. I think it's better to have some backlight or room ambient lighting. This may help control your pupil muscle. Your pupillary muscles will constrict with more room light, and this will give you a better sense of a depth of focus. Otherwise, if you're sitting in a dark room, depending on the screen, the light solely changing from your screen, your pupils, if it's a dark screen, your pupils will dilate, get bigger, and then bright light will come again from looking at something else on the screen. Your pupil will constrict, and it'll constantly be bouncing back and forth. And some people not only feel this change in muscle movement, but it can influence how your vision is seeing clearly, and it can influence how you're using your eye muscles to focus. So I think it makes sense that if you are sitting in the dark with a laptop light on, you might be at a higher risk of having eye strain. However, I've met even some of my best friends, they sit in a dark room with that one light on and they don't feel eye strain. So I think it's highly interdependent on everybody's case, but that's a good question. Hey, it's coming up to about an hour. I just want to give a shout out to all of our channel members. Thank you again so much. Gail just asked a quick question about stick-on readers. As far as kind of stick-on readers, I'm not really sure to what extent of stick-on readers you mean. I know I have a pair of reading glasses that clip onto my nose that are pretty cool. You know, they're kind of like Morpheus's sunglasses from the movie The Matrix. They just kind of clip onto the nose. But I don't know entirely what you mean by stick-on readers. But either way, hopefully that answers. And if you have more questions, drop them in the comment section. I hope to answer them later and tomorrow morning. And thank you. You're welcome, Barbara. Thank you so much. Just going to try to answer one or two last questions and we'll call it a night. Thank you guys so much. See lots of great love on there. Thank you guys. I know LBS here asks again, do prolonged use of IOP reducing drops, such as for glaucoma, affect the material of the IOL over long term? I have never seen a research study or publication kind of connecting the use of long-term glaucoma medications on affecting the plastic or the lens inside the eye. These plastics are largely inert and are not affected. And most medications for things like glaucoma don't penetrate that deep inside of the eye to begin with. So I personally wouldn't worry about that. However, long-term use of IOP reducing drops, especially ones that have a lot of preservatives in them, are known to cause worsening red eyes, dry eye. They disturb the homeostasis of the tear film. And so there's a lot of other issues. But typically for the implant from the cataract surgery, no. But I think that may be the last of our questions for this evening. Thank you guys so much for being here. I appreciate all of you. From here, if you want to learn more about things like cataract surgery, I do have other videos, including tips on how to better prepare for cataract surgery. Otherwise, let me know in the comments your favorite part of today's education, and if there's any other questions you have specifically about IOL lens implants. Thank you guys so much for watching, and we'll see you in the next one.